Thanks for listening to the Granite List Live. Today's episode is brought to you by Connect Healthcare Collaboration, where benefits marketing meets clinical advocacy to drive effective employee engagement.
Welcome back to another episode of the Granite List Live, where we discuss all things related to employee benefits and the human capital. I'm Lee Dill, and I am joined by Stu Baskin today, CEO of CannaPlan. So, Stu, let's just jump right on into it. Tell me more about CannaPlan.
Hi, Lee. Thanks for having me on. We offer a unique employee benefit program focused on healing naturally with medical cannabis as an alternative to pharmaceuticals. Our benefit program includes enabling employer contributions for physician and dispensary costs, which works similarly to an HSA. We have discounted physician visits for cannabis recommendations. We provide drug-free workplace policy consulting to protect all patients, including those taking legal medical cannabis. And we host optional educational workshops, which cover responsibly taking medical cannabis, including dosage, routes, which prescriptions can be replaced with particular cannabinoids, and just living healthy and well. Our goals are to give employees a choice in their medicine, reduce pharmaceutical use, and the costs associated with long-term drug treatment plans, and of course to promote healthier, happier, and highly motivated team members. We're also happy to work with benefit managers and HR administrators to navigate the implementation of the program.
Okay, so can you describe how cannabis does work as medicine?
So medical cannabis works by interacting with a system in the body called the endocannabinoid system, or the ECS. This system is spread throughout our organs and nervous system to help regulate things like pain, mood, appetite, and inflammation.
So how is it different from traditional pharmaceuticals?
Well, one of the key differences is that cannabis doesn't just target one single pathway the way that most pharmaceuticals do. Traditional meds are often designed to hit one receptor or one specific chemical process. Take, for example, ibuprofen. It targets inflammation through a pretty narrow mechanism. Cannabis, on the other hand, acts more like a network modulator. It works with the ECS, which is a massive regulatory system in the body that helps keep things like mood, pain, sleep, and immune response in balance. So when you introduce cannabinoids like THC or CBD, you're influencing the whole network, not just one switch.
So it's more of a systems level approach?
Exactly. That's what people mean when they say that cannabis is natural. It's not just about the plant being organic, it's that it works with your body's natural systems, not against them. It mimics compounds that your body already makes, called endocannabinoids, and that's the big reason why it can feel gentler or more holistic, especially for chronic conditions. It also explains why people use it for such a wide range of issues like pain, sleep, anxiety, and even seizures.
Okay, I'm going to go off script here and ask a question. Sorry. So pharmaceuticals, and maybe like we've as a people just have a wrong way of thinking that I think if I'm taking a medication, it is healing me, but it's really just masking the problems that I'm having.
That's right. So it turns on or off some receptors to try to stop whatever the issue is, like pain. So opiates turn off pain receptors, but they also turn on and off other receptors that are unknown, and that's what causes the side effects. And so when you introduce a pharmaceutical, it does target that pathway, that whatever condition you have, the depression, anxiety, pain. So it tries to block that, but the other things it does in the body cause the issues. And that's what we don't see with cannabis.
So cannabis kind of goes in and it works with the ECS system to see like what's wrong here, what's off here, and then deploys that way.
Exactly. It just helps your body's natural systems regulate. And so it helps them perform better: eyesight, hair growth, bone density, appetite, mood. Everything seems to be helped with the human endocannabinoid system.
Huh. Well, that's really interesting. Okay, so let's go back. We're talking about cannabis. Some people associate cannabis with marijuana, which is an intoxicating, not allowed in the workplace drug. So, set us straight here. What's different about your product?
And so, yeah, it's a totally fair question. And the simple answer is yes, marijuana contains THC, which binds to receptors in your brain that affect perception, mood, coordination, and memory. If too much is taken, then it can cause intoxication, just like other medications.
So, how do you make sure it's regulated and that not everybody is walking around using medical cannabis impaired?
Well, one of the main aspects is working with a doctor. We want to recommend people to feel better, but not necessarily have that side effect of being intoxicated. And a lot of people don't want to be intoxicated. So we recommend other cannabinoids like CBD, CBN, and THCV, which have known intoxicating effects, but can help with conditions like anxiety, pain, depression, appetite. And so THC is typically taken for pain, nausea, and muscle spasms. So really particularized uses. And the pain side is more of the mental side with the THC, whereas the CBD brings anti-inflammation. And so that actually helps reduce pain. With CBD, the inflammation, anxiety, seizures, and really just a plethora of other conditions that it can help with. So we help all of our members to understand which cannabinoids are intoxicating, and they can work with their doctor to find the best prescription regimen or recommendation. The other huge benefit to cannabinoid products now is there are many new delivery methods like capsules, tinctures, and topical creams, which all target symptoms without causing any intoxicating effects. And so particularly balms with THC and CBD are amazingly effective for sore muscles and again, cause no intoxication at all.
Okay, so let's dig a little deeper. What are some of the negatives that pharmaceutical patients often experience that you don't see as much with cannabis?
Yeah, so it's mainly the side effects from those receptors being turned on and off kind of willy-nilly. Traditional pharmaceuticals, especially for chronic issues like pain, anxiety, or sleep, come with a laundry list of side effects. Those can easily be searched online, but they include liver toxicity, cardiovascular and gastrointestinal issues, or even things like sexual dysfunction or mood swings.
Okay, so opioids can help with pain, but then wreck your gut and your brain over time.
Exactly. And opioids are a great example because they're incredibly effective, but they're also highly addictive. And overdoses are a huge public health issue that we've been fighting against now for years. Cannabis, on the other hand, has no known lethal dose. No one has ever died from taking cannabis. It's also not physically addictive in the way that opioids or benzodiazepines are.
It's really non addictive?
No, not physically at all. Everything can be mentally addictive. So even exercise, if you think about doing something, then that's an addiction, at least according to my parents. So if you think during your day, I want to have a beer, that's just addiction in your body talking, or any other thing you want to do other than the basic necessities of eating and sleeping and drinking.
Yeah.
And so, there's no physically addictive component to cannabis. So people can take it for years and then stop and not experience any kind of difficulties, no tremors, headaches, maybe some appetite issues there, but those will quickly fade away. And that would be if someone just is a very long-term patient, they would have a few days of, kind of lower appetite. And that would be the only side effect to quitting.
So you think of someone coming off an opioid addiction where they would physically see that progress as they become less addicted to it, but that's not really the case of a cannabis use.
Completely different, yeah. And so, opioid users might have tremors, nausea, a lot of anxiety, and just a whole plethora of, coming down, relieving that, drug from their body, the effects of that. My wife was given some kind of painkiller. I forget what it was after she had a C-section. It was an opioid, though. I think it was morphine. And she was shaking for days as her body came down from that.
Wow.
And so I just remember her sitting there shaking. I thought, if they could prescribe cannabis for pain, why wouldn't they try that first instead of straight up opiate?
Right.
But I guess, they had to block the pain receptors, and that's how they went with it. That's how most doctors go about these conditions. Somebody comes in with a condition, they say, okay, this is the medicine, this is the pharmaceutical. It's not typical that they say, you could try cannabis and exercise and stretching, work on your diet in this way, and that could also help overcome the majority of conditions that Americans are facing.
Wow. Yeah, the natural way. Lots of people don't think of it. So, okay, let's go.
And cannabis,
yeah, go ahead.
And cannabis is amazing for that too, because it's the only drug that gives so many different beneficial effects. So it can provide motivation, and then you can go work out with that motivation. And then after that, it can provide anti-inflammation. So you can kind of relax after your workout. And then it can stimulate your appetite, but also suppress nausea. And so there's these two sides to everything. The CBN helps you go to sleep really well at night, but THCV is great for waking up and just having energy. So all these different cannabinoids with all their different uses, and as people understand what benefits they can get from it, more and more people are moving in that direction.
And then how do you figure out, what is it you need and what is your dosage? And that's where you really need a doctor or CannaPlan to help you figure out what is right for you. Is that right?
That's right. And we have a network of doctors that are very experienced and can talk about all the different cannabinoids and the best prescription or best recommendation going forward for each patient and their condition.
Okay. And lower that pharmaceutical spend.
Exactly.
All right. So now I'm intrigued. Let's talk about antidepressants, anti-anxiety. You talked about how cannabis can help with anxiety. Talking about lowering our pharmaceutical spend, how can cannabis replace some of those medications that so many employees are on?
Yeah, it's really amazing. Statistically, 70% of Americans are taking one pharmaceutical and 24% are taking 4 or more.
Wow.
That statistic in itself is just absolutely insane to me. And so people will go in for one condition, they'll get a prescription. That prescription will cause a side effect. They'll get another prescription. That one will cause a side effect. They'll get another. So they'll get a first one. It'll cause nausea. So they'll get another one for appetite. And then that'll make them not able to sleep at night. So then they'll get another one for sleep. And they'll need another one for waking up.
It's a vicious cycle.
It is. And all of them cause side effects. So it's just this constant fighting against the next thing that's occurring while you're trying to fix your condition. So it's difficult for these patients, and a lot of SSRIs, the selective serotonin reuptake inhibitors, and benzodiazepines or benzos can help these patients, but a lot of them report emotional numbness, withdrawal symptoms, or needing to keep upping the dose. Cannabis, particularly CBD dominant strains, can reduce anxiety without blunting your emotions or putting you in a fog. It's more about regulation and suppression in this case. And like we mentioned, cannabis works with the body's natural system to restore balance instead of overriding them, and this greatly reduces the risk profile.
Okay. Can we talk about ADHD medication? Is there anything that cannabis can do for it?
So ADHD medicines are stimulant medications. A lot of adults drink a lot of coffee or caffeine, espresso, energy drinks, because those are stimulants. And a lot of adults have undiagnosed ADHD. So they've been all their life just drinking a lot of coffee. Mm-hmm. With those ADHD medicines, cannabis isn't directly recommended for ADHD. That would be more like CBD would be helpful for that because it helps calm the mind and body overall. So kind of a long-term dosage plan with CBD can help ADHD, certainly, but it does not replace stimulant medications.
Got it. Okay. So we talked about some positive. Let's be fair.
Actually, I should add a little note on that.
Okay.
With the stimulant medications, they're way overprescribed.
Right.
We've seen a lot of studies with ADHD that stimulant medications stop working after 1.5 years for kids. So if they're taking them for 1.5 years or more, there's no noticeable change in behavior at that point. They revert to their behavior that they were before that stimulant medication. We've also seen that if you have children switch their environment to an environment where it's more productive and hands-on and they're able to do things that they're more interested in, then those ADHD symptoms are reduced or eliminated. They're able to completely pay attention to something they're interested in. The energy level where students are in class and they just can't sit still and pay attention, that their teacher then says, this is a problem, he needs to be evaluated, or they need to be evaluated. They get sent to the doctor, get the stimulant medication, and then start that cycle potentially for their entire life, which is terrible. I don't think we should be giving kids stimulant medications at all. Just the way that the system's set up now, when a teacher complains, the parents are kind of forced to. They have to get that evaluation or the kid's kicked out of school. The doctor says they have to take a stimulant medication, and the school says they have to take it or they're kicked out of school. So we're in this terrible cycle right now with that, where if we understand that we can change the environment to help with those symptoms and give better attention to those kids, then we don't need to talk about stimulant medications or cannabis or anything. We can just treat them naturally through their environment.
Right. Would you recommend giving cannabis to children?
I don't recommend cannabis for anybody because I'm not a doctor.
Right. Good answer. Okay, so let's talk about downsides. We've talked a lot about positives and regulations and mood. Okay, what is the downside of cannabis?
So, of course, there's downsides. Cannabis isn't perfect. Nothing is. Some people do experience short-term memory issues, dizziness, or anxiety, especially with high THC strains. And for folks with a history of mental health issues, it needs to be used carefully and under doctor supervision. But overall, the risk profile is dramatically different. And for many patients, that's a life changer when they can move away from those side effects that they're seeing and just feel better naturally.
So for people dealing with chronic conditions, it's not just about treating the symptoms, it's about avoiding new problems created by the treatment itself.
Absolutely. That's where cannabis really stands out. Less harm, more flexibility, and a whole lot of therapeutic potential.
Okay, so let's go back to the business mindset of this. We talked about reducing pharmaceutical spend, but let's talk a little bit more about how cannabis really can reduce costs for the companies and what would the ROI look like for employers?
Yeah, so this actually surprises a lot of people, but medical cannabis can be a smart financial move for companies, especially those with high healthcare spending. Chronic conditions like pain, anxiety, insomnia, and even PTSD are some of the most expensive to treat long-term. And we see about 50% of working people having one of these conditions. And so you think doctor's visits, prescription costs, sick days, even disability claims. But with cannabis, many patients are able to cut down or completely stop most expensive meds like opioids, sleep aids, and antidepressants.
So are the majority of the direct cost savings coming from replacing expensive prescriptions?
Exactly. And it goes beyond that. You've also got reduced absenteeism. If an employee is in less pain or sleeping better thanks to medical cannabis, they're more likely to show up and be productive. One study even showed that in states with medical cannabis programs, workplace injuries and missed workdays actually dropped.
That's a huge savings, especially in industries like construction or healthcare where burnout and physical stress really are a thing.
Yeah, totally. Plus, companies spend a lot of money on things like workers' comp and disability claims. And when employees have access to safer, more effective pain management options, those costs can go down too.
So you're saying it's not just about the health benefits, it's actually a strategic move for companies trying to reduce long-term liability.
Yep. And here's the kicker. Cannabis is still relatively expensive compared to many prescription meds. Even when not covered by insurance, some patients find that medical cannabis saves them money out of pocket, which in turn can reduce the pressure on company-funded healthcare plans.
So in the big picture, cannabis could mean lower drug costs, fewer sick days, better performance, and even lower insurance premiums.
That's right. For companies willing to get past the stigma and look at the data, cannabis isn't a liability, it's an opportunity.
Okay, so let's say a company gets it. They want to support medical cannabis. How do they actually do that safely, especially when cannabis is still federally illegal?
It's a good point, and this is kind of the tightrope walk, right? Because on one hand, more than half the U.S. has medical cannabis laws, or half the U.S. states have medical cannabis laws, and on the other, federal law still classifies cannabis as a Schedule I drug, right up there with heroin, which is crazy. But so yeah, companies have to walk a fine line, but there are smart ways to do it.
Okay, so what's step one?
Step one's always updating policies. Many workplace drug policies were written in the 80s and 90s. They lump cannabis in with illegal drugs across the board. But modern policies can and should differentiate between recreational use and legitimate medical use, especially if the employee has a state-issued medical ID card. CannaPlan also helps companies update these policies to be inclusive of all patients. This can also help protect companies from lawsuits claiming wrongful termination due to discrimination if a medical cannabis patient fails a random drug screening.
So you're saying that companies don't have to go with an anything goes policy. They can create a reasonable accommodations policy?
Exactly. Just like with any other prescribed medication. If an employee uses cannabis for a legitimate medical condition, companies can treat it the same way they would opioids, insulin, or antidepressants. As long as it doesn't impair job performance or create a safety risk, there's room to support that employee.
But what about safety sensitive roles like drivers, machine operators, pilots?
Okay, this is kind of where it gets tricky. So, federal regulations still apply to those sectors. For example, the Department of Transportation has a strict zero tolerance policy. So, in those roles, companies might have less flexibility, but for non safety sensitive positions, there's a lot more legal room to accommodate.
Okay, so we talked about policy and legality, but none of this really works if HR teams and managers aren't trained properly. So, how do you equip them to handle medical cannabis in the workplace?
That's a key element. After the policies are updated internally, we really need HR on board because most HR teams didn't grow up learning how to navigate a world where cannabis is both legal in their state and illegal federally. It's definitely confusing. And so the first step for them is education.
But not just about the law, right? You've got to educate about cannabis itself.
Right. Most people only know cannabis through pop culture or outdated drug policies, so training should cover really the basics. What is medical cannabis? How does it work? What conditions is it used for? What's the difference between THC and CBD and other cannabinoids? And then once HR understands the therapeutic side, they're less likely to jump to outdated assumptions.
And then what about the legal side?
That's part two, and HR gets trained on specific state laws and what protections medical cannabis patients have, which is becoming very important in today's day and age. Federal restrictions, especially for the DOT covered jobs. They need to understand ADA and accommodation laws, which are constantly evolving. There was a case in the end of 2024 in Hillsborough County where a paramedic was fired for failing a random drug screening. He sued the county for wrongful termination due to discrimination and won. So now we see the standard for public sectors having to protect their legal medical cannabis patients like they would any other patient or potentially face liability for discrimination.
So does CannaPlan come in and educate the HR team, help understand the laws in the area, and then implement the doctors and the network for these employees to go to as there's a need?
Yes, we help with all that. We have educational workshops set up for the employee members, for HR, and even for the employers to understand better about how cannabis works and how the plan functions.
Okay, so that's super helpful. So we've hit the basics, cost savings, policy updates, and training. But let's talk about the bigger picture. What are some of the other benefits that companies are seeing when they allow or support medical cannabis use among their employees?
Yeah, and this is where it gets exciting. Beyond just reducing costs and avoiding legal headaches, companies are seeing real improvements in workplace culture, morale, and even performance. When a company supports medical cannabis, it sends a strong message that they're open-minded, inclusive, and wellness-focused. You're telling your employees, we trust you, we respect your health choices, and we are not stuck in the past.
And I'm sure that's huge for employee loyalty.
It's massive. Employees are more likely to stay with a company that supports their well-being holistically, and in industries with high burnout like healthcare, tech, or even education, giving people safe alternatives to addictive or numbing medications makes a big difference.
So you're seeing better retention, fewer burnout symptoms, and even improved mental health.
All of that, plus employees who manage chronic pain, anxiety, or sleep disorders with medical cannabis are often more present, more focused, and more engaged at work. And that's a productivity win.
Are there any effects on recruitment?
Great question, and big time, especially with younger workers, veterans, or anyone who's been turned off by rigid drug policies in the past. Being a company that acknowledges modern medicine and gives people options is a competitive advantage in today's hiring market.
So when companies support medical cannabis, it's not just about medicine and outcomes and ROI and savings, but it's also about modernizing the workplace.
Absolutely. It's about rethinking how we support health, how we define productivity, and how we treat our people. Medical cannabis is just one part of that, but it's a powerful signal that a company is paying attention to what people actually need to thrive.
Okay, so before we wrap up, what would you say the top takeaways are for companies that are considering supporting medical cannabis in the workplace?
Sure, I'll be happy to summarize. So I've got 6 points, I think. Number 1, medical cannabis is a legitimate healthcare option. It can help employees manage chronic conditions like pain, anxiety, PTSD, and insomnia without the side effects of traditional pharmaceuticals. Number 2, it can reduce healthcare costs, fewer prescriptions, fewer missed days, and fewer long-term disability claims. That's real savings for employers. Number 3, policies need to evolve. Outdated drug policies make room for nuance between recreational use and prescribed medical treatment, and protect your people while protecting your business. Number 4, train your HR management teams. Give them the knowledge to navigate cannabis conversations legally and compassionately. This isn't about promoting cannabis, it's about understanding it. Number 5, it boosts workplace culture. Supporting medical cannabis shows your company is modern, inclusive, and employee-centered. That builds trust, loyalty, and better retention. And finally, number 6, this is all about the future of workplace wellness. Companies that are ahead of the stigma and focus on the science will be the ones leading in talent, performance, and well-being. Medical cannabis is already part of the conversation. The question is, are you ready for it?
So if they're ready for it, Stu, what do these employees need to do or employers need to do to get in touch with you?
They can reach out to info@CannaPlan.com or me directly, Stewart, STEWART, at CannaPlan.com. Check us out online, learn more, and any questions you have, I'll be happy to answer them.
Okay. Well, great, Stu. Thank you so much for joining us on another episode of the Granite List Live.
Thank you so much for having me.
Thank you for listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.